Nice. Well, good morning, everybody. My name is Marty Mascari. I'm with the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center, or ADRC. The Area Agency on Aging and the ADRC are both under the North Central Texas Council of Governments. We are once again very blessed to have some of my cohorts with the Area Agency on Aging, Felecia Warner and Melinda Gardner, but we're also by video because today is a holiday for some people. We also have the Better Business Bureau Foundation of Houston that's going to join us with a video today. So we're going to do the presentation first, and then we'll follow it by the video from the Better Business Bureau Education Foundation. I'm sorry. Melinda, could you advance the slide so we can talk about CEUs? For those of you that are looking for CEUs that are attending today, we're providing CEUs for licensed social workers and licensed professional counselors in the state of Texas. We're also providing certificates of attendance. Now, if you have a different license in the state of Texas, or you have a license outside of the state of Texas, you're more than welcome to go through the process and get a certificate. The issue is that we're only set up for the state of Texas, and so whether your jurisdiction accepts it, that's really up to them. We don't have any control over that other than the state of Texas for those two licenses. In order to qualify, you must attend the entire webinar. You must complete the Google survey evaluation, and that should pop up as you close out of the Zoom today. If it doesn't, you'll receive that link also in a follow-up email as well. The survey link will be up for 1 week from today, and give us until the 7th of next month to get those out. We had a technical problem last month. We're still trying to get out all the ones from last month. We had a technical problem with the Adobe product that we have matching up with our Outlook, and it created some problems. So we're still working on getting those out, but we should get caught up and have these certificates out by the 7th of next month. So Melinda, I'm going to turn it over to you and let you introduce Felecia.
All right, wonderful. Thank you very much. And I am delighted to introduce Felecia Warner, who will be our speaker. She is a benefits counselor with the Area Agency on Aging. She has spent 17 years with the city of Waxahachie, and then she retired in order to care for her husband, which she still does, but she wanted to do something more. And so she had volunteered with the Area Agency on Aging for several years, also with the Ombudsman program. And then we were delighted to hire Felecia on staff in January. So she has been with us and helped with our benefits counseling, and she will be presenting today on our topic. Can anybody tell me what our topic is or what this slide says? It is a Medicare wuzzle to make you think. So what is this? Okay, we got an enrollment. Open enrollment, that is correct. We have the open door and we have enrollment, open enrollment. So that is what Felecia will be talking about today, Medicare open enrollment. So without further ado, I'll let her give you a little bit more on our agency and go forward with Medicare open enrollment. Felecia.
Hi, Melinda. Again, thank you for that wonderful introduction. I don't know if I can add anything, but I will. I have been a benefits counselor since 2009, and I still work for the city of Waxahachie, but I should have, as soon as I left the city, I should have came over to the Area Agency on Aging, because this is a wonderful position that I am in. I truly enjoy helping people. I truly enjoy giving out information and helping those who call our office to find the services that they need. Open enrollment I don't know if, and you can put it in the chat, if you are a provider or if you are new to Medicare, you know nothing of Medicare, just to have a little glimpse of what your position is on Medicare. But I like to always keep things very, very simple. Open enrollment is from October 15th through December the 7th. And people with Medicare can change their Medicare health plans and prescription drug plan coverage. So if you go to the next slide, Medicare open enrollment. Basically, when I talk to people, I always say, I want to make your experience new to Medicare, or whether you're changing plans, whatever your position is, as easy as opening a car door. So let's just begin. This training module was developed and approved by the Centers of Medicare and Medicaid Services. It's a federal agency that administers Medicare. The information in this module that I'm presenting here was done in September 2022. So if you need more information, you can always go to the CMS National Training Program.cms.gov for more information. So Melinda, would you do the next slide, please? And this is who I am, Felecia Warner, and I'm with SHIP, and that is the state healthcare enrollment for, that's the SHIP, that's the State in Health Insurance Center and Technical Assistance. I get my acronyms all wrong sometimes. And here's our office number. My number is toll-free 1-800-272-3921 if you're not able to see the screen, the slide. So the next slide, please.
Okay, I'm sorry. I was on the SHIPs are federally funded slide.
Oh, okay. So this a federally funded program is free local services to persons age 60 and older, caregivers and Medicare beneficiaries of any age to maintain their health, obtain public and private benefits, and to protect their rights, which is very important. So Melinda, I'm going to slide 4. And this, what is a SHIP? SHIP is the State Health Insurance Assistance Programs. And there, it'll state, we'll go to the next slide. SHIPs are federally funded. The program was established by Congress, and their work is funded through the U.S. Administration for Community Living at the U.S. Department of Health and Human Services.
Melinda, can you hear me?
Oops, have we lost Melinda?
We may have lost Melinda.
No, I'm here. I'm here.
Oh, you're here.
Oh, you're here.
Mhm.
The screen's not advancing, I don't think, right? Felecia? Are we on the right
No.
slide?
Felecia,
We're
are you
on
able to see the screen?
Yes, I am. What slide? I'm on slide 5. No, it's not the same one. It's
Is
matching up with
it SHIP snapshot?
the okay.
Snapshot.
Well, okay.
So the slide numbers may be a little bit different than yours.
Okay.
Okay.
So we'll go with this one. Sorry. I apologize
Okay.
for that.
You're good.
There are 54 SHIPs in every state of the union. And of course, you can see Puerto Rico, Guam, DC, and the Virgin Islands. That is a lot of people. We teach classes, we go to community groups and have a lot of very interesting questions from our target audience, which is our seniors and Medicare recipients. So we'll go to the next slide. How the SHIP can help you. You can understand your cost and coverage, compare options, enroll or change plans, or correct billing issues. And I want to say correcting billing issues, when a person has called me about Medicare appeals, it's been a challenge, but we usually, with the help of others, get that corrected or help them understand what the billing issue is about. And I think that's the most important when you are following the plan's details. So we'll go to the next slide. How your state health insurance assistance program can help you. We provide information that is local because Medicare plans are zip code specific. We provide unbiased information, and it's confidential and knowledgeable, and we can do it on the telephone or in person or virtual. But I think during COVID, we've reduced the in-person. So unless it's absolutely necessary, we'll do it by telephone or virtual visit. And I understand navigating Medicare. If you find it confusing, some people, it's really difficult. They read and they get advice from their friends, their family, a neighbor, or just a coworker. And it can be daunting. It can be overwhelming. But again, when they call our office, and I'm sure all my coworkers agree that we try to make it as easy as opening up a car door, and you just get in and go on your way to a healthy, successful aging on your Medicare. SHIPs provide local Medicare help. We're certified Medicare counselors. We do in-depth individualized counseling, which I must say some phone calls can last an hour or more, or we'll talk again the next day. We make educational presentations about Medicare, and those are always a lot of fun. And the questions from the audience are sometimes amusing, I think. So I like doing those. People want to know about how their Medicare works for them out of the country, or if they go visit family members in Florida or California, they want to know, will their Medicare work for them? And in some cases it does. And local can mean through libraries, community centers, medical settings, area agency on aging and disability resource center, anywhere people gather by the phone or even online. And I know we've learned all that from the pandemic, to where we're using a lot of virtual programs such as Teams and Zoom, which has become very popular, and I know there are more of those. If you have not gone to and viewed the SHIP website, I will strongly suggest that you do. It's a wealth of information on there. You find your local SHIP, visit the shiphelp.org or call that number on the screen, and you can find your local Medicare help. And so we'll have a review and listen to a little video about Medicare Advantage Part, which is sometimes known as a Medicare Advantage Part C.
People with Medicare have choices about how they get their coverage. If you have Medicare Part A and Part B, you may have the opportunity to join a Medicare Advantage plan, sometimes called Part C, if one's available in your area. These plans are another way to get your Medicare coverage instead of original Medicare. Private insurance companies offer Medicare Advantage plans like HMOs and PPOs. These companies contract with Medicare to provide you with all of your Part A and Part B benefits. In addition to your monthly Part B premium, you usually have to pay a monthly premium for your Medicare Advantage plan. Some Medicare Advantage plans offer coverage for things that aren't covered by original Medicare, like vision, hearing, dental, and other health and wellness programs. Most include Medicare prescription drug coverage, also known as Part D. There may be other Medicare health plans offered by private insurance companies. You can review and compare all of the Medicare health plan options available in your area by visiting medicare.gov/plan compare. Remember, you can only enroll during certain times and depending on your circumstances. Timing is important to avoid a gap in coverage and possible late enrollment penalties. You can contact 1-800-MEDICARE or a state health insurance assistance program or SHIP office near you for free, unbiased assistance.
Well, today's topic, and about the video we just saw, it's real quick, a lot of information on that, and we're just going to piece through it. It might sound like the Medicare Advantage is the way to go, as opposed to original Medicare, but there are other issues that each individual has to answer for themselves when deciding what plan, Medicare Advantage or a original Medicare. It might work for your sister who lives in California who has a Medicare Advantage plan, but will it work for you in Texas in 75154 zip code? So again, I want to keep everything just as simple as possible. When I speak to clients, I want them to know all their options, but they have to make that decision for themselves. So today's topic is the plan finder basics and user tips, and we'll do the Inflation Reduction Act, which is very new, and an overview and about the insulin cost entry process, and what is Medicare's open enrollment period. What are some things that I should consider? An agent, broker, do's and don'ts, and the marketing practices I think we'll all find very fascinating because as I've said in some presentations I've made, the scammers come out and they're pretty sophisticated, as we well know. They don't take off for their birthdays. I don't know any scammers, but I'm pretty sure they work right through Christmas to make sure they have separated you from your money. So let's go to the next slide. The Inflation Reduction Act became law just back here in August, on August the 16th of this year. It has implications for climate change, prescription drug costs, and healthcare costs and taxes. And I have to confess, I'm not real sure about those taxes, but we'll get to that. We'll all learn more about that. The Centers for Medicare and Medicaid Services, CMS, is implementing parts of the law related to prescription drug and healthcare costs. The time to review and compare your plans, of course, is October the 15th to December the 7th. During this time, you should consider cost coverage, and your provider choice. Yes, those are the three things. We don't know unless the client offers this information, we don't know what's in their wallet. I like to use that line from that commercial. And the coverage, the plan they choose, and provider choice. And they know what type of coverage they want. And I'll just say, when I'm talking to guys, and I love talking to anybody, but guys are so analytical. And I refer to making choices as you're going to take your car in for service. You want the oil change, you want the fluids checked, you want the tires and filters, the belts and hoses, and check the spare. You want to make sure, and the brakes. So guys, they love it when you're talking to, making references. This is how you decide what plan is good for you. This works out that you are at a point where you need to have all the bases covered for next year. And when you are choosing, or even choosing initially, or you want to change plans. And the ladies are kind of different. And I talk about shoes. Women, we all love to buy shoes, and we have shoes for different seasons, the spring, summer, winter, months. I have shoes. I have to confess, I have shoes. So it's important that we choose plans that are good for us, not something our sister has or our cousin has, but something that works the best for you. So to explore more information, you can call Medicare.gov. You can do the Medicare Plan Finder at medicare.gov/plan compare, or call Medicare 1-800-Medicare and go from there. Or you can call your ship. Next slide. If you have Medicare and take insulin, which about 3 million people do, and it's rising, you will pay no more than $35 for 1 month supply of each covered insulin. So this is wonderful for those in our community that need to take insulin. The deductibles, the copay, people with Medicare who take insulin are encouraged to get help in comparing plans during open enrollment, which is so important because a lot of people don't realize that by reducing your out-of-pocket expenses saves you money in the long run, keeps you healthy because you don't have to necessarily worry about, am I running short of money this month and I won't be able to get my insulin. If you have not experienced a client telling you the difficulty they have had in accessing their drugs, especially insulin, it is an eye-opener. So next slide. Because the Inflation Reduction Act passed in August of 22, our plans, our providers, the plans bid packages, the plan data displayed in the Medicare Plan Finder won't reflect the Inflation Reduction Act insulin cost sharing cap. The Plan Finder only displays the cost included in the annual plan bids, and those bids can't be updated outside the annual process. So when you're on the Plan Finder, basically this says some of those prices that are in there won't be reflected. So it's best to, again, call the plan and go from there. However, the point of sale at the pharmacy, some people with Medicare won't pay more than $35, which is so good. And deductibles won't be applied with respect to the covered insulin products. And there are some tips. Medicare.gov will describe the new insulin benefit, which is good. And the Medicare Plan Finder will use targeted notes to alert insulin users that insulin costs might be different from what is displayed in the plans. Healthcare plans must update their materials, evidence of coverage, annual notice of change, and those annual notices of change should have been out in September. We encourage people with Medicare who take insulin to get help comparing plans this year through 1-800-Medicare or a SHIP counselor. Here we are. Information and help in the open enrollment period. And these are some of the places you can go: Medicare.gov, Medicare Plan Finder, Texas SHIP, and there's 1-800-252-9240, Medicare, 1-800-Medicare. Customer service, and I have called them and called on a Sunday just to ask some questions, and very helpful. I'm surprised I was not put on hold, but I wasn't. But I'm sure during open enrollment, those lines will be busy. They're available again 24 hours, 7 days a week. They're only closed on Thanksgiving And they're language line interpreters for more than 200 languages, which is absolutely amazing. And it's wonderful. But I like the 24-hour, 7 days a week. And here's our Medicare.gov homepage. And I love his hat. His hat is so cool. This page comes up and welcome you to Medicare. And when I walk clients through this website, welcome to Medicare, get started with Medicare, and most do not have an account set up. I suggest that they do. You don't have to. You can log in as a guest and continue your search. But to log in and create an account, it saves your prescriptions. You can look up your Medicare summary notices, your prescriptions, and I should go back. Your prescriptions are saved, and you can go in and delete what you need to or add what you need to, and it will save those, and it'll always be handy for you to come back to when you are ordering your prescriptions through the preferred way, which is the mail, and it comes in very helpful. And the next tab is to find health and drug plans. That's will pull up your Medicare plans in your area and where you can compare your drug and your health plans to each other on a screen that's easy to read. And you can, if you like, you can print it out. And it just makes for easy viewing to see what plan has what compared to each other. And you can find healthcare providers. Say you're looking for a dermatologist, and you would just pull that up and you'll see the ones in your area and how many miles, and you can use the filters. And I'm sorry, I didn't mention using the filters on the health and drug plans, because if you have a preference for a particular health insurance, you can just look at those plans. If you like at Medicare Advantage HMO or PPO, you can look just specifically at those, and you can put price ranges or benefits that you want, vision, dental, hearing, and you can filter all that out, filter out what you don't want to see. And also with finding your healthcare providers, again, if you were looking for a dermatologist and you only wanted to see a woman and you wanted her to be within 15 miles of your home, you can use those filters. And if they're taking Medicare, and phone numbers are on there, and I find that those numbers are pretty up to date. And then the next tab, you can call our office, which is the SHIP, or talk to someone at Medicare. What changes can I make during this time? And this is where it gets kind of confusing, because you can change from original Medicare to a Medicare Advantage, or you can change from a Medicare Advantage to an original Medicare. You can join a new prescription drug plan. You can switch, but whatever you do, switching, whatever is there in place by December the 7th, that's the plan that you'll have. And be careful with your Medicare, with your Medigap policy, switching, and you might not be able to get the same plan when you switch back to original Medicare. How should I review my current Medicare health and drug coverage? Regardless, again, as the slide states, of how you receive your Medicare, you should consider access to health providers you want to see. And in the city, that's pretty somewhat easy, but in the rural areas that I've been in, it's harder for our clients to access providers that they want to see. I know I've been in Corsicana, And some individuals had to come all the way into Dallas to see specialists that took Medicare. And it's difficult. And especially if they're ill and they have to get maybe their daughter or a family member, another family member to drive them into Dallas. But they should consider access to healthcare providers that you want to see, access to preferred pharmacies, access to benefits and services that you need, and the total cost of insurance premiums, deductibles, and cost sharing amounts, and the quality of care. The quality of customer service you receive. And everyone wants good customer service. Go to the next. Thank you. If you have original Medicare, visit medicare.gov or read the 2023 Medicare and New Handbook to learn about Medicare's benefits for the upcoming year. I can't tell you how many times I've talked to individuals, especially during presentations, and I'll ask them just a question, just to start a conversation. Have you read your Medicare and New Handbook? No, I put it in a drawer. No, it's on the table. No, I don't know where it's at. It's almost like having the guidebook to the stars. Everything is in there. The questions that you have, the answers are often right there in the book. And if you want more information, you can call the SHIP office or medicare.gov. But when people tell me I don't know where that book is at, and I didn't read it, but we should encourage our clients to read the book. You can call again Medicare, 1-800-Medicare, or contact our office if you do not have a Medicare handbook. And the Medicare handbook will be online in the website where you can go to medicare.gov. It'll be right there. You can print, well, I wouldn't advise printing it out, never mind. You can receive your handbook by mail or electronically from 1-800-Medicare. You can also log on to or create your Medicare account and to sign for an electronic handbook. How should I review my current coverage? Medicare health and drug coverage? Of course you should. If you have Medicare Advantage plan or a standalone Part D, read your plan's annual notice of change or evidence of coverage. Review these notices for any changes. And I did my own, and I was pleasantly pleased that the cost have gone down. So the plan costs, the plan benefits, and the overage rules, or the plan's formulary or list of drugs your plan covers. Make sure your drugs will still be covered next year, and the pharmacies that you use will still be in the plan network. If you need assistance, of course, you can always call SHIP, State Health Insurance Assistance Program, for unbiased counseling. And this is a big issue. We can't predict what our medications that we'll be taking. Maybe the doctor might add a new drug that you really didn't plan on. And it's hard to say, but does the plan cover all the medications that you take now? It's important to know that, because that will help reduce your out-of-pocket expenses. Does the plan have restrictions on my drugs, prior authorization, step therapy, and quantity limits? How much will I pay for monthly premiums and annual deductibles? How much will I pay at the pharmacy for coinsurance or copays for each drug I take? And this is where we talk to seniors, and we know seniors take medications, sometimes a lot, sometimes, and I'm going to say more than they should. But we also want them to reduce their out-of-pocket expenses. So you go through each drug and it'll tell you on Medicare, on the Medicare Plan Finder that the prescriptions that you're taking, the costs will be lowered if you use the mail-in prescription, or if you use this or certain preferred pharmacy. And it should give you all those that are in your area within, you can use the filter on this, within 5 miles, 10 miles, even 15 if you like, for a pharmacy, to make sure you are reducing your out-of-pocket expenses. But I prefer the mail-in, which I can just say here, because that reduces my out-of-pocket expenses even more. And I don't have to worry about going to the pharmacy and standing in line or waiting in the drive-through for that. Is my pharmacy in the plan's preferred network? If you pay the least, you pay the least if you use the preferred network pharmacy. And of course, the Plan Finder will give you that. Can you fill your prescriptions by mail? Most, yes. What is the plan star rating? If I have retiree coverage, will the Medicare drug plan work with this coverage? In most cases, yes. The Medicare Plan Finder tool can be helpful to get a list of Medicare Advantage and Part D plans, the drugs they cover, and the costs for the year, which is amazing when you look at it. And it'll tell you, if you use this pharmacy, the mail pharmacy, you'll save $400. I'm just using a roundabout figure. But if you use the pharmacies, local pharmacies, you might save $80 or something. And of course, you want to swing right back over to the mail-in pharmacy. But you people, clients need to make that decision for themselves. How much are the premiums, deductibles, and coinsurance and copay amounts? And you should consider this when choosing a Medicare Advantage plan. What are the annual maximum out-of-pocket costs for the plan? The amount may be higher, but can protect you if you have expensive healthcare costs. What service area does the plan cover? Are my doctors and hospitals in the plan's network? What are the rules I have to follow to access health care services for my drugs? Does the plan cover additional health care benefits not covered by original Medicare? Am I eligible for them, or are they only available to certain members? What is the plan star rating? Will this plan affect my additional coverage I may have? These are important to think about it, but that top one, how much are the premium, the deductible, and the co-insurance and copay amounts? And because this affects our clients' daily life. And it's generally the important thing to remember, that we don't know unless they offer the information about their income. And then we also mentioned that there are plans that can help you pay for your Medicare premiums, so that amount can be put back into your Social Security. And next slide. What are some of the things I should consider when choosing a Medicare Advantage plan? And this is one of the good things. Medicare Advantage plans usually include a prescription drug coverage. Individuals with Medicare Advantage plans cannot have a Medigap. And that's shocking to some when they first hear that. If you have original Medicare and a Medigap and are considering switching to a Medicare Advantage plan, know that you will lose your Medigap as well. You may face limitations with Medigap enrollment depending on the state in which you live, unless you are eligible for a special enrollment period or re-enroll in a Medigap policy. And that can get confusing if you have original Medicare and a Medigap and you decide you want a Medicare Advantage. And then you get to the special enrollment period that ends in March for changing, and then you decide you don't want it. It can be stressful for some of our clients to know that they might not be able to get that same Medigap policy back. Star ratings. I like to compare this sometimes to hotel ratings. Would you want to stay at a 5-star? Sure, everyone wants to stay at a 5-star. And some of the plans are too new to be even rated. The quality ratings that provide a measure of a plan's performance. Medicare scores Medicare Advantage plans and Part D plans in several categories, including quality of care and customer service, which is important. Ratings range from 1 to 5 stars, with 5 being the highest. Plans are assigned an overall star rating to summarize the plan's performance. Plans also receive separate star ratings in each individual category reviewed. The overall rating provides a way to compare performance among several plans. So if you're choosing, say you have on the screen, you're on Medicare.gov, and you have 3 plans you're looking at. So you have one that's a 5-star, you might have another one that's a 5-star, and then one you really like that's not even rated. So it's again left up to the client to choose which one. We only provide unbiased information, and we don't steer anyone to any particular plan. We just point out and summarize for them what they're looking for, and they get to decide, and they can always call the insurance company to ask those specific questions. Star ratings are only one factor to review when comparing plans in your area. A plan with a higher star rating might not be right for you. It might be, again, right for your sister that lives in the next down the street from you. It might be just perfect for her. It's important to see whether the plan covers the health services and drugs you need, and works with the pharmacy you use before considering its star ratings. Keep in mind, the star ratings in the Medicare and You handbook are not necessarily the most recent. And I like to talk about that. Again, our clients talk to everyone, talk to their families, they talk to their friends and neighbors, and they're just sometimes overwhelmed with information that in most cases is not true. And they'll want to have a drug plan that their relative has, and that's not always possible because, again, the drug plans are, like the health plans are, zip code specific. An online searchable tool for the official government Medicare.gov website, available for users logged into their Medicare account, which is the best experience, and I want to say it's the ultimate experience, is to have that, and it just helps out a great deal. And people who just want to be guest users. Allows users to compare Medicare health and drug plan options. Again, the Medicare Advantage plans, Medicare drug plans, Medicare supplement insurance, and Medigap policies. Provides detailed information on coverage, costs, and benefits of different plan options in your area based on your prescriptions. Visit the Medicare.gov/plan compare to find plans in your area. And I can't say it enough that it's the best tool to use. And we encourage all of our clients and people we speak with to, if they're on Medicare, to go to the Medicare.gov website, log in, create an account. What kind of supplemental and benefits do Medicare Advantage plans offer? Well, they're pretty good in some cases. A supplemental benefit is an item or service covered by Medicare Advantage plan that is not covered by original Medicare. And because we know original Medicare doesn't offer vision, dental, or hearing. To receive supplemental benefits, it's important to follow your plan's rules, which they'll tell you all the time. Follow the rules, yes. Some commonly offered benefits include dental, vision, and hearing, and some gym memberships, which is pretty nice. Most supplemental benefits must be primarily health related. These benefits can be either optional, choose to purchase, or mandatory, cannot decline the coverage. And when I talk to clients and we're speaking about a Medicare Advantage plan, and I will tell them that basically with the the vision, and the hearing, don't get excited. It's not paying for everything. It's a help that you can access that. You can get your cleanings twice a year, major dental problems. For some seniors, it's not going to pay for everything, but it will help. What kind of supplemental benefits do Medicare Advantage plans offer? Medicare Advantage plans can also cover special supplemental benefits for the chronically ill that are not primarily health related for beneficiaries who have chronic illnesses. These benefits address social detriments of health like meal delivery, transportation, and home air cleaners. And in the rural counties, which I have mainly been in, transportation is always an issue. Again, if you have to ask your family member or a friend to take you to the doctor's office, and it might be harmful that they have to take off because maybe their employer might not appreciate them taking off to take someone to the doctor. Not everybody has the good jobs in the rural areas where they can take off and help a loved one. Meal delivery, such as Meal on Wheels or another type of meal delivery, home air cleaners, which are big help. But not every plan member will have access to the same set of benefits. But I think transportation is a big issue in the rural counties. And next slide. Thank you, Melinda. What kind of supplemental benefits do Medicare Advantage plans offer? If you're interested in supplemental benefits, review the plan's evidence of coverage and any other materials, find out the costs and overage restrictions associated with those benefits. How can I protect myself from marketing violations and enrollment fraud? Oh, I used to say in my presentations, if they call you, hang up, and you have my permission to say a bad word, because they will call you all through the day. And anyway, during Medicare open enrollment, there's a higher risk than usual for fraudulent activities. And we know that scammers, they don't take off birthdays, they don't take off holidays. They're busy trying to separate you from your money. Medicare has rules about how plans can and cannot communicate with you during Medicare open enrollment period to market their insurance products. Before you enroll in a plan, make sure you understand that what the plan covers, how it affects your Medicare benefits and other health benefits such as Medicaid or your retiree or union coverage, and whether it covers the drugs you need. And again, I stress that, whether it covers the drugs you need, not, again, you don't know what your health, you might have an issue come up that was totally unexpected, but with the information you have, you need to make the best decision. And here we get to the agent broker do's and don'ts. And there's some serious ones. Medicare Advantage and prescription drug plan marketing. Prohibited agent broker behavior or Medicare Advantage or prescription drug plans. And the green, well, you can see the green is the appropriate agent broker behavior for Medicare Advantage or prescription drug plans. Prohibited agent broker behavior plans. They can't state that they are from Medicare or use the words or symbols, including Medicare, in a misleading manner. For example, they cannot state that they are approved, endorsed, or authorized by Medicare or calling on behalf of Medicare, or that Medicare asks them to call or see the beneficiary. And that's why it's so important that we as benefits counselors state this to our clients, that those individuals who are willing to sell you a plan that will, they believe will be the sun and the stars, and they'll sell it and they'll go on their merry way, and then you're stuck with this plan that's no good. It won't pay for any of my prescriptions. I can't see the doctors I want. But if those individuals are coming into our communities, we can't always stop them, but an informed client will be able to tell that I don't need those services that you're offering because you're not with Medicare. The prohibited behavior for agents, brokers, they may not market to beneficiaries door to door, including leaving materials at a beneficiary's doorstep. This still goes on. We had in Waxahachie a group of individuals who put on white jackets, pretending to be in the medical field, and put stethoscopes around their neck so they looked really super official, and went door to door knocking, and people answered the door because they were dressed as it looked medical representatives, and they sold plans up and down this neighborhood. And it was quite, we had to get the police. I remember talking to the police chief about these individuals, and some of the rules that they flaunted by going door to door and selling plans to these individuals in their homes. They should have been arrested, but it was not a pretty sight. So we'll go to the next slide. Prohibited agent broker behavior for Medicare Advantage and prescription drugs. They cannot send unsolicited text messages or leave voicemail messages. They can't, but they do. They may not approach beneficiaries unsolicited, door to door, walking up to cars and approaching in parks and supermarkets. They do. They have approached people in the parking lot of the HEB or the Walmart and seen an individual on a walker that they'll approach them and tell them that, hey, I can get you a better walker with that has all kinds of bells and whistles and stuff. And, you know, let's come over here and we'll talk about your Medicare. And here we go. They cannot market. They cannot conduct marketing and sales activities in healthcare settings, except in common areas. Restricted areas include, but are not limited to, exam rooms, hospital patient rooms, dialysis centers, and pharmacy counter areas. They still do, but as much as we can, we try to stop that. Cannot make unsolicited calls, including contacting beneficiaries under the guise of selling non-Medicare Advantage plans or non-prescription drug plan products, PDP products. They still do. Cannot provide meals or at marketing and sales events. They still do. Cannot contact marketing or sales, cannot conduct marketing or sales activities at an educational event, including distributing marketing materials or enrollment forms. A few more items. The following information is from the Medicare.gov marketing rules for Medicare plans. People representing Medicare plans aren't allowed to ask for your personal information, like your Medicare, Social Security, bank account, or credit card number over the phone unless it's needed to verify membership. It's hard to determine enrollment eligibility or process an enrollment request. Plans don't need your personal information to give you a quote, but how many of our seniors are so willing to give that information? People representing Medicare plans aren't allowed to offer you cash or gifts worth more than $15 to join their plan or give you free meals during a sales pitch for a Medicare health or drug plan. People representing Medicare plans aren't allowed to ask for payment over the phone or online. The plan must send you a bill. People representing Medicare plans aren't allowed to tell you they're the Medicare, that they're Medicare supplement insurance Medigap policies. People representing Medicare plans aren't allowed to sell you a non-health related product like an annuity or life insurance policy during a sales pitch for a Medicare health or drug plan. People representing Medicare plans aren't allowed to make an appointment to tell you about their plan unless you agree. You must agree. During the appointment, they can only try to sell you the products you agree to hear about. Independent agents and brokers selling plans must be licensed by the state, and the plan must tell the state which agents are selling their plans. And this is good. Keeps our clients informed about the do's and don'ts. And I'm always very hopeful that when our clients learn a fact about what should be taking place during some of these meetings with brokers, that they'll be able to report those brokers if they're not following the rules. Rules for meeting with an agent. If you're going to meet with an agent, the agent must follow the rules for Medicare plans and some specific rules for meeting with you. During the meeting, Medicare plans and people who work with Medicare plans can give you plan materials, which is good, tell you about the plan and the options, and get more information, give you an enrollment form, collect your completed enrollment form, which is good, and talk about the plan. Leave business cards for you to give to your friends and family. During the meeting, Medicare plans and people who work with Medicare can't charge you a fee to process your enrollment plan, steer you into a particular plan, communicate incorrect information about the plan type, or use inappropriate statements like their plan is the best or the highest ranked. During the meeting, Medicare plans and people who work with Medicare can't tell you about other plan options you haven't agreed to discuss, important point, unless you specifically asked about them. To discuss these options, you need to complete a separate appointment form. Pressure you into joining their plan by saying things like, you have to join this plan or you won't have coverage next year. I'm not optimistic about that. During the meeting, Medicare plans, people who work with Medicare can't ask you to give names and phone numbers or addresses so they can sell to your family and friends. Ask you to sign the enrollment form before you are ready to join. Will I have opportunities to change my coverage in the upcoming year? Yes. Medicare open enrollment ends December the 7th, 2022. Any necessary changes must be made in order for the changes to take effect in January of 23. If you need to change your Medicare coverage in 23, you have an opportunity to make changes. And this gets confusing also, because I think in the ultimate, the wisdom of having this available is that some things that you thought might take place doesn't happen and you're unhappy with your plan. You have an opportunity to change it. So you have your Medicare Advantage plan, you'll be able to make one change to your coverage between January 1 and March 31st. This enrollment period is called Medicare Advantage Open Enrollment Period. You can switch from Medicare Advantage to another plan, another Medicare Advantage plan. You can only do that one time. Switch from a Medicare Advantage plan to original Medicare with or without a Part D prescription drug plan. Go to them. If you need to change your Medicare coverage in 23, you may have the opportunity to make change if you have extra help. And that's one of the programs that helps with the premium. The federal government, the federal program that helps pay for some of the most most of the out-of-pocket costs of Medicare prescription drug coverage. You will have a special enrollment period to enroll or switch to Part D plans once per quarter in the first 3 quarters of the year. That's January through March, April through June, July through September. There may be other circumstances when you can be eligible for a special enrollment period to change your Medicare health or drug coverage. Better Business Bureau Education Foundation. I want to thank everyone for listening and thank you for your patience. I hope this has been informative. And thank you, Melinda, and thank you, Marty.
All right. Thank you very much, Felecia, for sharing that information. I think I answered all the questions in the chat that we've had so far. If not, we will go ahead with the recording and then we can go into those after that.
Sounds great. Sounds great. Let me share the recording.
I have to stop sharing. There we go.
I got to work on the sound, so stay on Melinda just for a second so I can make sure the sound is working.
Yes.
That should work. So we will get going here. Do you want to introduce it at all, Melinda?
All right. Well, the North Central Texas Area Agency on Aging actually partners with the Better Business Bureau Education Foundation, which is responsible for the Texas Senior Medicare Patrol. And so they provided a glimpse kind of what some Medicare open enrollment scams are. So we're going to have a short video from them, and then we'll be around to answer any questions.
Sounds great. Here we go.
Thank you.
Hi everyone, I am Angel Hansick and I am the Outreach Specialist with Texas Senior Medicare to collect that information and send it to the correct authorities.
It kind of jumped, but
Medicare
it's
open
okay.
enrollment period
Let me go
is
back.
from October 15th to
I'm gonna
Hi
start.
everyone, I am Angel Hansick and I am the Outreach Specialist with Texas Senior Medicare Patrol, and today I'm going to be speaking with you about preventing Medicare open enrollment scams. So what is the Senior Medicare Patrol? We are a federally funded program, and there's one of us in every single state, including 4 of the U.S. territories. We recruit and train volunteers and professionals about Medicare fraud and abuse. And we also report intentional fraud and abuse to Medicare fraud control units. So you're able to call our hotline and report any fraud, and we actually help you collect that information and send it to the correct authorities. Medicare open enrollment period is from October 15th to December 7th every year, and this is the time when Medicare beneficiaries are able to join, switch, or drop a plan. Open enrollment is generally the only time that you can switch, join, or drop a plan. It can seem super intimidating and even overwhelming, but it doesn't have to be. Even though open enrollment can seem like a super stressful and overwhelming time, we really want you to feel empowered and like you are in control of the plan that you are choosing. We encourage you to review your Medicare Part D and your Medicare Advantage plans every single year, every open enrollment period. These plans can change, and you want to make sure that your prescriptions and your doctors are still in your network. So, did you know that Texas is the 3rd largest state for Medicare beneficiaries? We are only beat out by California and Florida. There is approximately 4 million Medicare beneficiaries in the state of Texas. So that is a huge number, and there's a lot of people that are switching, dropping, and joining plans during this enrollment period. So here's a quick overview of the 4 parts of Medicare. Part A and B are what's known as traditional Medicare. So this is a combination of hospital and medical insurance. So Part A covers hospital stays, skilled nursing facility care, home health care, hospice care. And Part D covers the medically necessary services like doctor's visits and outpatient care, any sort of tests, and some therapies and durable medical equipment. 70% of beneficiaries are on traditional Medicare. For Part C and Part D, Part C is Medicare Advantage. So this is private insurance that covers the same benefits and services that Medicare does. For Part D, this covers prescription drug costs. So any sort of co-payments, deductibles for your prescriptions. That's what Part D covers. And then, of course, there's Medigap, or Medicare Supplement Insurance, that covers any sort of holes that can be left in the coverage in traditional Medicare. So if you have any sort of questions on benefits, we encourage you to call 1-800-MEDICARE, and there's that number written out for you. We also encourage you to go to www.medicare.gov or contact your local SHIP, Area Agency on Aging, and to review your Medicare and You handbook. All right, awesome. So now let's get into the common scams of open enrollment. Scammers read the headlines. So this is to let you know that if there's anything happening in the news, any big life events that are going on, the scammers are aware of it and they are changing their scams to stay up with the times. A great example of how scammers are changing their tactics to stay up with the times is from looking at COVID-19. Because of the pandemic, scammers changed a lot of their tactics, and there has been a lot of increased activity in the following areas. So increased telemarketing calls, increased marketing solicitation in medical offices, and increased activity on electronic platforms, so such as social media like Facebook, Instagram. They're using customized ads, so that's something to definitely look out for. Also, please remember to be vigilant and extra cautious. Never share your personal information with someone who contacts you unsolicited through the phone, through text message, email, and through social media. Okay, so why are they contacting me? Why do they want my personal information? These scammers might be trying to get information from you, such as your Medicare number, which can be used to commit Medicare fraud or medical identity theft. This is where they're charging things to your Medicare account, such as services that you never received, or you're getting charged more, or getting double charged for services that you did receive, but maybe it's not supposed to be that expensive, or you were charged multiple times for the same service. These are all things to look out for. So some common scams that we're seeing are when quote-unquote Medicare or a health plan calls you and wants to send you a new health card for only $299. If any plan is calling you and offering to send you a new card for a low fee, a one-time fee, it's very likely a scam. Go ahead and hang up. Also, please know that Medicare is never going to call you, and no plan is allowed to cold call you. They're only allowed to contact you if you've given them explicit permission. Another popular scam is if you receive a call about a refund from last year's premium or your drug plan costs. And so they may say that you didn't use all of the money, and so you're actually able to get a check for X amount of dollars, or it rolls over into your next year's plan. This is a scam. That's not how premiums work, and so you will not be receiving any money. Go ahead and hang up on them as well. Another scam is an agent tries to sign you up for a plan that you don't need, that isn't right for you, or doesn't even exist. So please be wary as you're speaking with brokers. Make sure you take the time to really review these plans. Do not rush into anything, and make sure that it's the right plan for you. Please go over it with a trusted individual. It's also very common for scammers to represent themselves as government officials. They will contact people through the internet, over the phone, or even coming to their doors asking questions about health insurance, or offering them new cards to replace their current cards, all while pretending to be someone of authority. This is a very common scare tactic to try and get your information. There's also very common for fake prescription cards to offer big discounts when there's actually no benefits. They're just wanting you to pay for something that you're not actually going to receive any services from. It's also very common to receive a call offering big discounts on a new health insurance plan, saying that it's a limited time offer, act now, it'll be gone in the next few days. Absolutely not. Open enrollment is from October 15th to December 7th, and you have that entire time to choose a plan. Also, reminder, no healthcare plan is allowed to cold call you, only if they have explicit permission. So if someone is calling you from a plan you do not recognize, you did not tell them that they could call, hang up. This is illegal practices. All right, so enrolling in a plan. We urge you to shop and compare plans by calling 1-800-MEDICARE or by visiting medicare.gov, or to get a family member to help you if you're not used to using the internet, if you're not comfortable with it, or you can call the Area Agency on Aging and talk to a qualified benefits counselor and have them speak through that with you. They are not endorsed by anyone. They are not trying to sell you anything. They're just there to talk through the plans with you. Also, there are plenty of ways to enroll in a plan, such as flyers that you get in the mail or a booth at a public venue. But no matter how you choose to enroll, please do your research, take your time, and ensure that this plan is actually right for you. So here's a few tips and tricks on how to stop fraud during open enrollment. 1, please know that Medicare will never call you and they're never going to visit your home. They're only going to send information through mail. Also, guard your Medicare card and your number just like you would guard your credit card. Don't give that number out to anyone. Don't leave it out in public spaces. Keep it tight and secure. We also encourage you to not take it with you whenever you're going out and traveling, or if you're just running to the store. Only take your Medicare card with you if you know you're going to use it at your healthcare office. Also, don't give your Medicare number to anyone except your doctor or other providers. Don't let anyone push you into making a fast decision. Open enrollment is from October 15th to December 7th. You have that entire time, so please take that time to review these plans and ensure that it's the right one for you. If you receive a call, especially from a number you don't recognize, or anyone who's requesting personal information such as your Medicare number, your birthday, your credit card information, hang up immediately. Do not speak with them. I know a lot of times it can be fun or entertaining to kind of have a scammer on the line if you know that they are getting your information, but whenever you speak to them on the phone, they actually register you as a real human being, and they sell your number to other scammers. And so it's just encouraging more scammers to call you. So just hang up immediately, or don't even answer the phone. If there's someone who really needs to talk to you, they'll leave a voicemail for you. Also, we encourage you to know your healthcare options. Get help from your family, the Medicare website, or your local state health insurance assistance program, your AA. Final reminder that Medicare will never ever contact you by phone or come to your home. If anyone is calling you or showing up at your house claiming to be Medicare, this is completely a fraud. It is completely a scam, and we encourage you to report that to the Texas Senior Medicare Patrol. Our number is here on the screen. You can call us, let us know, and we'll gather that information with you and send it to Medicare, to local law enforcement, the attorney generals, whoever is the appropriate person to send that to. They will never, ever contact you. Medicare does not have the resources or the time to be contacting 4 million Medicare beneficiaries just in the state of Texas. So please be wary. All right, awesome. That is all that I have for you guys today. Thank you so much for listening. And once again, if you have any questions about enrolling, please contact your local AAA, contact Medicare, or go to medicare.gov. And if you see anything, please report it to our number here. All right, thank you so much, and y'all have a wonderful day, and happy Medicare Monday.
Great. Very, very good. I'm going to go ahead and stop sharing. I'm going to ask Melinda if you would reshare so we can go over the CEUs real quick. And then we want to make sure, we'll just leave that up for right now when you're answering questions, but we want to make sure we go over the CEUs before the end of the time. So go ahead.
All right. There were some additional questions and comments in the chat and the Q&A. Someone asked about the features from is there a chart that shows features from providers? I'm not exactly sure exactly what features. That would be something on the plan's website in order to see what they provide for a particular plan. It also talked about an accurate provider list. It's always a good idea to contact the doctor to see if they are accepting Medicare clients and if they are accepting new clients, because sometimes they may be a Medicare provider, but they may not be accepting new clients. So keeping that in mind. I'm not sure why a list would be sent of children's dentist if you're not looking for a plan for a child. That's something to talk to the plan about as far as what they're sending. Okay, and then in our Q&A, do not communicate personal information by phone. Yes, that is what we're trying to say, is basically do not share that information. One of the things in the video said Medicare will not call you. Well, they will not call you. If they happen to call you, they are already setting up that time and date and you will receive that information. But it's very rare, because we found out that they were doing surveys, but they would let you know ahead of time. The other thing we found out recently is that Medicare does send out emails. And so they said a beneficiary may receive an email possibly once a week during open enrollment. But make sure if you're clicking on something that it does say it is the official Medicare email, because it will have that information in the email. If you are unsure, do not even open up a link or click on a link in an email. That's really the bottom line.
Can I suggest something there? Wouldn't you suggest that they hover over the email address? A lot of times the email address that shows up on the thing, if you hover over it, it will show a different email address behind it, which is a very, very common scam tactic that it'll look like it, but if you hover over it, you'll see a real email address behind it that's fraudulent. You know, that's from the scammers, not Medicare.gov. Which I guess it would be Medicare.gov.
It would say Medicare.gov. That's a very good point, because sometimes for me, because my vision is not as good as it used to be, if I hover over, I may think I'm seeing Medicare.gov, and it could be misspelled, but to me, it looks like Medicare.gov. So really pay attention to that, making sure that it's spelled Medicare.gov and not Medicare.com or Medicare. Something else, or maybe it's Medicare, but without the vowels. I mean, there are so many ways that scammers will try to convince you that it is an official email. But yes, if you hover over the email address, it should say Medicare, Medicare.gov. That's the official Medicare website, or official Medicare email address. Another question, can you enroll in a plan in October, then in November change your mind and enroll in another plan? Yes, you can enroll in a plan October 15th. You can enroll in a plan October 16th, October 17th, November 1st, 2nd, 3rd. What you're enrolled in on December 7th will be your plan for next year. Keep in mind that if someone enrolls in a plan if someone requests enrollment with an agent or a broker or a person, and that enrollment doesn't go in until December 7th, even though you may have enrolled in another plan in November, if that first enrollment request doesn't go in until December 7th, that's the plan you're going to be in. So it's always a good idea to verify after 10 days, the plan that you want to be enrolled in is the one that you are enrolled in. So calling that plan and verifying that you are going to be in their plan as of January 1st.
I have a question for you. Go ahead. You finish that. I have two questions for you. Go ahead.
No, that was it.
Okay. Well, let me go over the CEUs since we're right at the time, if we could. And then if I could answer the question after that, ask the question after that would be great.
Okay.
So for those of you that are joining us for CEUs today, we are set up to provide CEUs for licensed social workers and licensed professional counselors in the state of Texas. we're also providing certificates of attendance for those of you that would like them. Just so you know, those certificates will be emailed out to the email address that you put in the survey that you're going to answer after today's webinar. But just so you know, we're set up for licensed social workers, licensed professional counselors in the state of Texas. If you have a different license in Texas or you have a license outside of Texas, you're more than welcome to get the certificate. But it's up to your jurisdiction whether they'll take it or not. We have no say so over that. We only know that we're set up for Texas and for the 2 licenses. You must complete the entire webinar. You couldn't have missed more than 5 or 10 minutes of this morning's webinar to qualify. You must also complete the Google evaluation survey. It should pop up as you close out of Zoom today. If it doesn't, because of a pop-up blocker or some other reason, you will receive that link in a follow-up email for you to fill out. You'll have until a week from today to complete the survey, and then give us till the 7th of next month to get those certificates out to you. And then let's go to the final slide to talk about next month's topic. So next month, we're going to be talking about how Medicare works with military benefits and open enrollment scams part 2. And that will be on the 14th of November. Please join us for that. I realize we'll be in the midst of open enrollment and you'll have lots of questions. So come with your questions. Hopefully we can answer those as well. But the question I had for you all is, so if someone drops out of a drug program, I guess it would be part D, for 2 years and then doesn't have any and then tries to reestablish one, I found out somebody said there's a lifetime penalty that they pay.
That is correct. If someone does not have drug coverage, any accreditable drug coverage for more than 2 months, then there are only certain times that they can enroll. And so October 15th through December 7th would be a time they can enroll. They wouldn't start until January 1st. And there is a 1% per month penalty based on the average premium amount that they would have to pay for each month that they did not have coverage.
For each month that they didn't have coverage, or
right.
So is it 1%
per month
for 1 month and 1%, 2% if you were out without coverage for 2 months?
Right, correct, and so on. So 2 years would be 24 months of coverage of penalties.
So you pay the penalty. I just want to clarify. You would pay the penalty for a period of 24 months, or you would have 24% added on to every month for the rest of your life?
Correct. You would have 24% added on. Now, unless you qualify for extra help, or that you could show that you had an employer plan that included drug coverage, or maybe you had VA coverage that included drug coverage, those are considered creditable coverage. And so therefore you would not have that penalty, but you may have to go through some steps to make sure that you're not charged that penalty. You have to prove that you had coverage.
Wow.
Yes. Yes.
I want to talk to you offline about that, because my mother's in that situation. And I'll just point out for everybody, my dad had a gambling problem. My dad had a horrible gambling problem, left my mother, passed away a year ago, left my mother with little, very little. But he stopped paying their drug program so that he'd have the money to gamble with. And so now he's deceased and she's stuck with that penalty.
Oh, wow.
Ongoing, on top of the fact that, and she's just barely above the extra help threshold.
Oh, yeah, we can talk offline. We can definitely talk offline.
And I only say that for everybody else's benefit, so they understand the situation, so because they know people in similar situations, you know.
Right. Yeah. I do want to add to our topic for next month. We are going to talk about the plan finder as well. We're going to talk about how Medicare works with military benefits, and then discuss the plan finder and go through some of the steps of comparing plans. So
Nice, nice. I'll add that to the title before we issue the flyer out.
yes,
Yeah,
yes.
yeah.
There were a couple other questions. So I'll go ahead and answer. If you want to keep everything the same, should you also verify this? What actions need to be taken? If you're not changing plans and you have not received anything from the plan saying, you know, they're going away or anything like that, you don't have to do anything if you're not changing. If you want to verify, yes, you can do that, but if you have not made any changes, you have not talked to anyone about making changes where they may have accidentally enrolled you in something, you don't have to do anything if you're going to keep your same plan, but it's still a good idea to compare plans because maybe you have a new prescription and maybe that prescription may be covered differently next year. So it's a good idea to review plans just to make sure that a person is in the plan that works best for them. There was another question. A lot of thank yous. Okay, what if you never obtain a drug program and decide 3 years later after initial enrollment, which we just kind of went over? If there was no creditable drug coverage, then there could be a penalty assessed in addition to the monthly premium. That penalty is 1% per month that a person did not have drug coverage. And the average monthly premium, it's around $33. So you're talking about 33 cents times however many months. It could be 32 cents or 35 cents, but it's around there times the number of months that they didn't have coverage.
Wow. I just posted, for those of you that didn't, that came on late, I've just reposted the link for the slides for today's presentation. If you didn't get those, you're more than welcome to grab that link out of the chat and download those slides if you'd like.
There was a comment, residents are so trusting that they can have someone tell them to drop it and they will.
Yes.
That's a salesperson. That's what a salesperson does. They are looking to make the sale so that, you know, possibly for the commission, but it is important that individuals understand what they're getting into. I have suggested during my presentations that if someone is going to any type of presentation or talking to someone, it's fine to listen to the presentation, but then don't sign up right away. Go talk to somebody, make sure you're understanding what you're getting into by sharing that with someone else, running it by someone else so that you understand fully what type of plan it is, if your doctors are in the network, if all your prescriptions are covered. So all of that does play into the decisions that you make during open enrollment and outside of open enrollment. Can you switch from original to an Advantage plan, then switch back to original more than once? Each year during open enrollment, you can switch back and forth. It's definitely your choice. And then January through March during Medicare Advantage open enrollment, you can switch to original Medicare by enrolling in a prescription drug plan. So you have October 15th through December 7th for prescription drug coverage, whether that be through a Medicare Advantage plan or a prescription drug plan, or Medicare Advantage open enrollment, January 1st through March 31st is when you can switch Advantage plans also. So at either of those times, you can go back to original Medicare by enrolling in a prescription drug plan. Keep in mind that you will be responsible for the Medicare co-pays and co-insurance.
Two things. Number one, someone asked about the link to the survey. I just posted that in the evaluation survey. I just posted that in the chat as well, in case you'd like to just get it there. The other thing is someone asked about the presentation link. It's going to be the same. I'm going to email the link out to you as well, but it's going to be the same link. So if your computer just it's not a, you know, those warnings are warnings that if you're not aware of where it's coming from, be careful. All I can tell you is it's coming from me. I promise I'm not trying to mess up your computer, but you're going to get, the link's going to be the same that comes in the email, and it's probably going to give you the same warning, just to make sure you know where you're downloading it from before you do it. That's all I can suggest, but that's the only way I have to get it out to you, is through a link. So,
And the recording link that is going to be shared will include the recording of the presentation as well as the SMP recording.
Yes. And I'll send out the link. Yes, both. That's right. You'll get the link to the Better Business Bureau recording when you get your first follow-up email, and that will come with the slides. And then the second one, the second follow-up email will come with the recording of today's full presentation, with the Q&As that we've answered live. So, well, very, very good.
Great.
Melinda, Felecia, thank you so much.
Thank
very,
you,
very,
Marty.
very good.
You're welcome.
Yes.
Yeah.
Thank you. All right. Have a great day, everyone. Thanks for joining.
Thank you all for joining us, and y'all have a wonderful day. We're going to be